Friday, everybody. Dr. Amy Ostick here at Health and Healing Direct Primary Care in Woodland Hills. What?
I'm Dr. Brian Ostick. I'm the husband.
Okay. And local ER doc. We want to talk about something that I've seen an uptick in the last several months that is, I think, indirectly related to COVID and the pandemic and the shutdown. On a quick note regarding our numbers, we are making great strides when it comes to our community transmission here in LA County. For the first time, we're under 200 cases per 100,000 for the last few days, and our positivity rate has been about 5.4, 5.7%, which is great. It's under 8%, which is where we need to be to get off the watch list in terms of identifying us as high levels of community transmission. So that's really good. The masking is really working. The social distancing is really working. But still, don't get lazy.
Well, that's good. We're going in the right direction.
We're going in the right direction for sure. Get your flu shot. Absolutely. 100% positively, yes. Please.
Your flu shots are in, so.
Yes, flu shots are in. A lot of places we have ours, and we are here for you if we were giving them to our members. So
if you're a new member to HHDPC, you're giving out for free.
You can get it for free. That's right. If you sign up this month or next month. So I would like to also talk about today some things that I've seen that have concerned me over the last few months. Is with all of our bars and restaurants being more or less closed, and especially our bars, one would assume that maybe we're drinking less.
That's not true. It looks like the drinking has gone up, and sales of alcohol are through the roof.
Yeah, for sure. And I think there's a lot of reasons at play here. Certainly emotionally, we're feeling a lot more stressed out. That's kind of our pop-off valve, and our self-medication is to drink more. But also it's more easily accessible. It's at the house. You're not going anywhere. You're not driving anywhere. You can get it delivered to your house. Some restaurants are even doing drinks to go or as takeout.
Right.
And I wanted to touch on it because there are going to be a lot of indirect health effects of this pandemic, and it's something to just take inventory on. And I wanted just to give you an objective criteria as to when you should be thinking to yourself, maybe I'm drinking too much. And it's actually not as complicated as it may seem. As a lot of people, they're like, well, 3 gin and tonics are not the same as maybe 3 glasses of wine, or 2 ounces. I only put 1 ounce versus 2 ounces. And I think we overthink it and we overanalyze it because it's behavior driven.
Right.
And so there's an easy way to think about this, and this is how I screen my patients for alcohol use.
Break it down for us.
Okay, so the USPSTF, which is the United States Preventative Task Force, really made this easy for us a few years ago when we talk about screening. And what they say is for males, if a male is drinking more than 4 drinks, any drink, at one time, they are in a alcohol misuse category. For females, if they're drinking more than 3 drinks at one time, that's considered in an alcohol misuse category. And on a weekly basis, it's 14 drinks in a week for a male and 7 drinks in a week for a female. That's just something for you to sort of take a step back, take stock, and think, okay, I just had 4 drinks in a night. Maybe I'm in that kind of a risky behavior category. Harmful alcohol use is when you start to see physiological, emotional, behavioral effects from the alcohol, and that's harmful alcohol use. And then there's certainly alcohol abuse, and that's when abuse is really, again, more defined by it's interfering with your ability to function at work, to function at home, responsibilities to your family, to your coworkers, etc. That would be alcohol abuse. Misuse is still useful because I think it's something that we tend to, as a culture and a society, tend to write off as, it's okay because we're enjoying ourselves and it's social and acceptable. But I think it's important to think about those definitions and think, wow, yeah, I have had more than 7 drinks in a week as a female, for the last few weeks, and that's more than I usually did before COVID, because I didn't really even have the time, and I had other coping strategies and other outlets. And if that's you, first of all, it's everybody right now probably, and you're not alone.
Right.
And realizing that you are in getting into a risky category of misuse.
Talk to your doctor about it if you have any questions. You're pretty good at counseling people on that for sure.
Right, and it is something that we get a lot of training and counseling, and we can help tease out if you are in an abuse category or not, and if it's really just misuse at this point. What are some ways we can strategize, and what are some ways we can deliver better outlets for you, so that it's the alcohol isn't something that we turn to every time to self-medicate.
What should I tell my patients in the ER that come in intoxicated, some of them unconscious, and then they tell me they've only had 2 beers? That's the classic, right? No, everybody in the ER has only had 2 beers.
Only 2 beers, yeah. I know it's hard. I know in the ER it's a tough place to do any sort of counseling, but you're very lucky that you're married to a family medicine doctor that can encourage you to maybe take the 2 minutes, that 2-minute opportunity once that person is alert and oriented and is ready. It might be their rock bottom. And you never know in the ER where that person's been, what their experiences have been like, what their past trauma history has been. And so we're always talk about, being careful of anchoring people and putting them in a category. And writing them off as just alcoholics.
Sure.
If
you've ended up in the ER though for alcohol use, I would call it probably it's affecting your life at that point. That is an alcohol abuse, and you probably need to get some.
You need some more professional help.
Yes.
For sure.
For sure.
But take that opportunity, Dr. Ostick, to make that suggestion and say it, and that could be a wake-up call. Like, you're in the ER now for your alcohol use.
Right.
That's a big problem.
And we do give people resources for outpatient treatment centers for alcohol abuse and drug abuse and those sorts of things. It is an opportunity. I agree with you.
It's an opportunity. Don't waste it.
All right.
So Dr. Amy Ostick here, Health and Healing Direct Primary Care. If you have any questions, you can visit us at www.healthandhealingdpc.com for all of our monthly blog posts. And we have a YouTube channel.
6 subscribers.
We have 6 subscribers.
It doesn't monetize very well when you only have 6 subscribers.
Smash that like button. And you can call us at 818-600-2426 to learn more about our model. Thank you, Dr. Ostick.
Thank you, Dr. Ostick. Good job. Good information today.
Thanks. Bye.